Welcome, FamilyAffaires.com contributor Dr. Dan Gottlieb. Hi, Dr. Dan.
Hey, Roseann.
Dr. Dan, today I'd like to talk to you about therapy. And I know that you have some very strong feelings about therapy. Yes,
What?
yes, you. Just recently we ran an article on FamilyAffaires.com about tips about selecting a therapist. And, from my observation in dealing with people, with friends and family, people have this feeling that if they're seeing a therapist and they go once a week, and that all of their life problems should get resolved during those weekly visits. And that somehow if you go long enough, eventually life will be perfect. So you're a therapist, and I know that you don't practice traditional therapy.
It's Gottlebian. It's kind of
Okay.
an amalgam.
Okay, well, let's talk about how can people enhance their experiences in therapy or enhance where it is that they're trying to go? Because I'm a believer that it's not just in that session that things should be happening. There's other things that can be done to help people.
What are you looking for in therapy, and who's responsible for that therapy? The therapist is the person with the flashlight on their helmet, but you have to point them.
Right, they're a tool. The therapist is a tool, where many times I think that people look for the therapist to guide them and to give them the answer.
Well, we think that way about medical doctors, right?
Mm-hmm.
I have this symptom, I'll go to the doctor, he or she'll fix it with a pill or a knife. Now we're learning even that's not true.
Right.
We have to be involved. It's got to be teamwork, or else we're not going to get to where we want to get to. And it's the same with therapy. There was research many years ago that was published in Consumer Reports, and it was a study about the efficacy of therapy. And what they found then was that the therapy efficacy reaches its peak between 12 and 14 months. Beyond that, the value goes down.
Okay.
So, I don't know if very long-term therapy helps or not. I've had patients in therapy for a very long time, and it's not therapy per se, and we're not looking for improvement or change, although sometimes we are. But what my patients are looking for now is more guidance, more companionship, more understanding that they wouldn't have elsewhere.
Okay.
And in the old days, before everybody moved around the country, we had that.
Sure.
In our extended family, in our clergy, we had that. But now, unfortunately, sometimes therapists play that role, and in a way it's sad.
Or maybe it's just that they're looking for a non-judgmental voice to speak to.
Same thing.
Yeah.
In the old days.
I don't know, though, about family. Clergy, yes, but I think that with family, their stuff tends to get in the way, because somehow inevitably it'll always become about them or something. So what can people do to help aid in the process?
First of all, and I want to say this to those who are seeking therapy, in therapy, and I especially want to say this to therapists, that it's my strong belief that the path to mental health is through the pursuit of social health. As long as that lens is focused inward, you're at risk for increasing suffering rather than decreasing suffering. That you're not going to get to where you need to be in that office. Neither the therapist nor patient or client or whatever we're going to call them this week. That you've got to go outside of that room. you have to practice. You have to practice whatever you're learning, whether it's mindfulness, whether it's a journal, whether it's interacting with other people, whatever it is, but go out of therapy and practice. If your self-esteem is low, help others with their low self-esteem. If you feel isolated and withdrawn, go help others who might feel that way. And if you're so anxious, go help animals. Just practice. And what causes us suffering is inevitably habitual behavior, habits, habitual reactions to A, B, or C. And what we have to do to diminish suffering is to change our habits, doing things differently, one step at a time.
And practicing it, like you said. Because anything new that we're going to learn, we have to practice.
Over and over and over again. And it's not going to be pretty, and it's not going to be comfortable.
No.
At first.
Great advice. Thank you.
Thank you.